Hello, I'm talking to Jessica Grace, who is the Program Manager for the Technology Enhanced Screening and Supportive Assistance Program at the UNT Health Science Center. Jessica, can you tell me a little bit about what TESSA does and what your major concerns are right now for the people that you serve?
Sure, absolutely. So the TESSA project, as Emily just stated, it stands for Technology Enhanced Screening and Supportive Services. We are a program that provides services both in clinics and in our local agencies that serve intimate partner violence victims. And so I manage a team of health advocates that work out in the community and respond to either patients or like I said, clients of like our local domestic violence shelter or family justice center, and help link them to resources for their healthcare, talk to them through safety planning and support services if they are in a abusive relationship or might see those red flags in a relationship. We talk through health coaching and health advocacy, which is also linking them to those partner agencies or to healthcare. And so we are a team that really focuses on the intersection of interpersonal violence and health. And so that's kind of our program. And that's what we do. Sorry.
So what are your biggest worries right now for the patients that you serve and clients that you serve?
Well, I think for us, the biggest concern during this time of staying at home is that with a lot of our families and with our clients, obviously there's a lot of people in the home, potentially if they have children in the home. And so with the uncertainty of the times, with potential loss of income, the stresses that come just with the partner relationships being close and in the same space, as well as having lack of childcare, and those concerns, just that increased stress level, we are concerned about that creating an increased opportunity for conflict. And when obviously there's an increase in conflict, that can increase levels of abuse and neglect or violence in the home. And so that is really what our concerns are. I think we've already seen locally that there have been reports about child abuse, and the calls to the domestic violence hotline have gone up. And so our concerns is that our clients who typically may have other strategies for keeping themselves safe or their kids safe, those may not be available to them if they have to stay at home and have to isolate themselves from some of those support systems. On the second point of that, we are concerned about that even for those who may know of the resources that exist in the community to help, a lot of those agencies, just like ourselves, are having to work remotely. They may have limited or no walk-in hours anymore. And so the accessibility to victims needing help is reduced, right? It's just the reality is that it's reduced right now. And so that is difficult for all of those of us who work in service providers, because we're trying to find creative ways to make sure that we are responding to what we are seeing as an increased need for these services, but without being able to be in the same space or have large groups together or office on our site. So I think those are the two biggest worries, is that increase in the stress and violence that can occur because of those stress, and then the limited or reduced capacity to serve those victims based on the agency's inability to be available in the same way as before.
So Jessica, I know you lead a team of 4 health advocates and some other graduate students. Tell me what you're doing differently right now to address these needs.
Sure. So I think one of the unique parts about TESSA is that we have always had some level of technology capabilities more than some of the other agencies. So I think we are a little bit more agile and nimble to be able to respond in a different way. For example, all of our health advocates have in the past been able to use text messaging. We have FaceTime on our phones. We use iPad screeners at the clinics. So we're familiar with using video chat or sending text messages to clients to say, how are you doing, those things. What we've done since this crisis has emerged and we've had to work remotely is just been really intentional and even more and targeted in reaching out to every single one of our clients, to just let them know that we know that this is a difficult time, even if they were doing okay and have already accomplished goals, that this might be triggering more stress or anxiety that they were successfully managing before, but may now not be able to get into their counselor, for example. And so we're intentionally trying to reach out with them. We are right now this week creating digital content, ways to maybe record videos similar to this technology, where it's just maybe 30 seconds of a breathing exercise that you can do at home if you start to see those stressors and that anxiety go up. What are different strategies you may need to use now, that, you know, new tools in your toolkit per se, to address some of the new challenges that this presents. We are also looking at whether we can send those text messages. We are creating a newsletter. And just whatever way is most accessible without people having to read a whole lot of content, whether that's what you can do at home with your kids for, you know, a block of time to just connect with them and to reduce stress levels for everyone. And then we are in communication with our local nonprofits who, at the course of this pandemic, really had to restrict our obviously presence in their agencies. And so we are hoping, and we have been communicating with them, to be able to find some other ways to use technology such as Zoom, to continue or those services in a virtual programming format, whether that's helping individually, of course, engage with their clients on some of their needs that they might have, whether that's doing some more wellness groups like we've done in the past in the shelter in some way. So we are trying to be innovative and trying to respond to our clients' needs and our partners' needs, through using technology, and recognizing the increased need at this time. So those are a few of the things that we are doing right now with TESSA.
Thank you so much, Jessica. It's great that you all are thinking creatively and using your resources to respond to the changing needs right now. Thank you so much for talking to me this morning.
Well, thank you.